quite a few people have been asking me about photography, so I thought I'll do a photography lecture. This is actually from a photography live lecture I did. The thing with photography is you need to most of all understand that how our eyes see and how a camera sees are very, very different. We look at this picture and we think, wow, that's amazing, our eyes would see that, but our eyes actually don't see things near as good as this. Our eyes are not very good cameras at all. It's only the way our brain manipulates what we see that makes it seem really high definition. This is actually what an image on the back of our retina looks like. So you can see there's a tiny bit in the middle that is clear, and everything else is kind of fuzzy, and there's blood vessels and there's the fovea, which is the bit where there's no information at all. So that's what we actually see. And the only reason things look clear is because we move our eye around. So the little tiny spot with good focus gets moved around all the time. So this is how we imagine our photographs will look. So we see a photograph like this and we don't really notice anything. We just go, wow, that's a pretty photograph. And so then we get the camera out and we try to take the photograph ourselves. Now, of course, when we actually look at the scene, this is what our eye sees. So if we're looking at the tree, if I go back to the previous picture, you can see this is how it looks in a photo. If we look at the tree, that's kind of what we're seeing. Just the tree, everything else is out of focus. So understanding that our eyes look at things very different to a camera is very important, because then when we go to take a photo, this is what we actually take. So if you've done many photos, you'll know you've done this. You've been so focused on the tree that you haven't noticed that the horizon is crooked, and you haven't noticed that you've stuck the tree right in the middle of the picture. Now, the thing about landscape photography is that you stick one thing right in the middle of the photo, it almost never looks any good. It looks unbalanced. So the first thing about photography is what I call centering. So there's three main things. The first one we want to talk about is centering. Now, dental photography and landscape photography are quite different. Landscape photography, you almost never, there's always exceptions, but almost never want the object right in the center of the viewfinder, because it just doesn't look balanced out. We think things are balanced when they're off balance. So we've got level. These are very difficult things in dental photography too. If we go back to centering, quite often when you've got a row of back teeth, you might be looking at the premolar, but if you put the premolar right in the middle of the picture, then you also have a picture of the lips and the snot of the nostril. So you often have to put the premolar right at one side of the viewfinder so that all the other back teeth kind of go right across the viewfinder. This is level. Now, because we're so busy looking at the tree, it's very easy to forget that the picture has to be level. So you want to run your eye around the corners of the viewfinder and then across the middle and any straight lines go, is the picture actually straight? So this is level with a dental photo, but this is the typical thing we see online. So this is the not level photo. We've got a set of teeth and they're not going across the viewfinder, they're going diagonally. Okay, or the front tooth picture, this is one I took years ago, so way back when I couldn't take pictures. Okay, I'm so busy looking at that front tooth, I haven't noticed that I'm just on a really weird angle, so the teeth all are going across at an angle. Okay, there's the center, but there's the level. Now the last thing is you want to look for distractions. So distractions are anything that's just going to draw the eye away. Now, a classic example would be amalgam. If you remove an amalgam, you have to wash the rubber dam, or it's just going to be amalgam bomb. No one will be able to look at your tooth because they'll just be distracted by the amalgam. So these are classic examples of distractions. So someone's taken a photo, but they haven't looked around their viewfinder to see the fat chick with her undies out, or the dog doing a poo in the background. So you want to look all around for distractions. So here's distractions in dentistry. So you can see we've got the photo. but there's just amalgam sprinkles everywhere, okay? And so it makes, even though the work might be good, it makes it look messy. So we've got to run our eye around and look for things like amalgam. We've got to look for bits of tooth, cement, blood, all sorts of bits and pieces that are just going to distract from what we're actually trying to show. Now, the last problem is what I call the whale watching picture. So you can see here, picture of a whale. It looks like a tiny dot because you're so zoomed out, you can't really even see the whale. So here's a whale watching picture in dentistry where zoomed way out, and all you can see is you can see the eyes and the hair and all this sort of thing. All we're interested in is the one tooth. This is what a whale watching picture should look like. Up close, we can see the whale, we can't see the whole ocean, and it's all beautiful and crisp. And this is what a tooth picture should look like. Up close, we don't see the eyes, we don't see the hair, we don't see the tats on his face, none of that. We can just see the teeth we're interested in. So we've got the centre, level, and then we look for distractions. So there's a few distractions here, just a little bit of air abrasion powder, but that's okay. So with our centering, level and distractions, now we add framing. Okay, so these three really form the whole basis of photography. We have things like exposure, but really if you don't have the framing, so you don't have the center in the correct spot, the level picture and no distractions, then the picture is no good. And this all comes from seeing through the camera properly. Now, obviously, make sure that your viewfinder is focused. Okay, I've had people spend all day taking photos with their viewfinders out of focus, and very, very difficult to get things focused. Now, the last thing is exposure, and the reason you need to understand this is not so much for simple flashes, but if you get into complex flash photography, then it becomes much more important to understand the exposure. So basically, if it's correct, it's basically right. If it's overexposed, it's too bright. If it's under, it's too dark. Both our eye and the lens have an iris, a thing that can get bigger or smaller. And as it gets bigger, you can see in this diagram, you get more light, but you get a shallower depth of field. So this is showing depth of field here. So you can see on the top left there where it says f1.8, the iris is open really, really wide. The things at the front of the picture are in focus, but the things at the back are not. You can see right down in the corner on the lower right. The things that are, we've got the iris closed down more, and you can see we've got bigger depth of field. So things at the front of the picture are in focus, things at the back of the picture also almost in focus. But notice how the picture's getting darker. That's because there's less light coming in. So you can see here, everything's the same except the iris, okay? And as the iris gets smaller, the depth of field gets bigger, but it also gets darker. So in dentistry, we need a flash because otherwise the photos would be far too dark. These are just some standard things I use. So generally, if I'm taking a picture of the full face, I want to use about f5.6, and if I'm doing the inside the mouth, about 18 to 25. Don't go all the way up to 32, because when you go up to 32, you actually start to have such a tiny iris or aperture that you start to get distortion of the pictures. So you start getting down closer to quantum mechanic level and making the light do weird things. So here, once again, we're just looking at the shutter speed. Obviously, as the shutter gets slower, we get more light and we get more blur from movement. So as it gets slower, we get more blur from movement. Now, when you look through a telescope, you'll notice that the things that you're looking at tend to jiggle about a lot. That's because you're looking at something so far away, you only have to move the telescope the very tiniest bit. And it's kind of, if you're looking at, say, a ship 2 kilometres away, you imagine you're holding a stick 2 kilometres long. Now, you don't have to move a stick very far so that the tip that's 2 kilometres away moves many, many metres. okay? So when you zoom in, it's like you're using a telescope. Any movement gets exaggerated just the way it does with the telescope. So when you look at the ship with your naked eye, the ship doesn't move. But when you look at the ship through the telescope, you'll notice that as your hands shake, the ship's jiggling around inside the telescope view. And so zooming in with your camera does the same. So the more you zoom in, the more movement is a problem. So that's why we need to have a fairly high shutter speed. So the little curtain inside the camera that opens to let light in must open and shut pretty quick. Otherwise, as your camera moves in your hands, the teeth are going to look like they're moving over the image and you'll get a blurred image. So generally, you need a shutter speed about 1/100th of whatever the zoom is, which 100mm zoom is 1/100th of a second. Now, ISO works by changing the sensor. ISO you don't need for most flashes, but if you start getting into flashes with diffusers, you will need to change the ISO. So basically the sensor is made up of a whole lot of little pixels. If you increase the ISO, it groups pixels together to form big pixels. So if you go to 200, it joins every second pixel together to form one big pixel. It means you need half as much light to make the picture work, but your picture's going to be kind of more dotty. So here you can see in this picture, at 100 ISO, the picture's really crisp, but kind of dark. At 800, it's much brighter. But if you look up really close, you can't really see it on this screen resolution, but it's kind of more dotty. Here's a better example. So, 1/80th of a second, at an ISO of 80, okay, it's very dark, it's black, okay? As we go up to 3200, which is as high as most modern cameras go, the picture gets much brighter, but we're also getting a lot of errors. So you can see there's a lot of noise, which is just random things that aren't really there. So if we look at the smile photo, you can see that we've got the corners of the mouth. This is just my standard. Okay, I want to see the corners of the mouth and I want to have the smile level. I want the person's head level with the floor. So you often have to move someone's head because most people have a head tilt. Now when I'm doing the side smile photo, I'm generally focusing on the lateral incisor. And I just want to see the canine on the other side. So you can see the same here. I'm focusing on the lateral, just see the canine on the other side, centering, level, distractions. Obviously the distraction here is the moustache. I can't do much about that, so I'm just going to leave that be. Centering, level, obviously there's no distractions because it's just a standard photo. So if we're doing the retracted teeth apart, you can see centering, level, and distraction. So we've got retractors to move the lips out of the way because the lips are the distraction. Now once again, doing these side views, I'm generally focusing on the lateral incisor. If you're doing orthodontic shots, you need to either use a mirror or retract a lot further because it's very, very important that you can see where the first molars sit in relation to each other. Side view centering, level, lateral incisors, okay? So we're using lateral incisors as our level. Now when you're doing quadrant shots, okay, once again, try and get the row of teeth going straight across the screen. So you can see in this picture, it's a full arch picture, and because it's hard to get the mirror straight, you can see it's not straight. So we've got the center roughly in the right spot, but there is a little bit of it's not quite level. You could fix this in editing, but it's still a little bit of a problem. This one's better because you can see that the middle of the tongue is going straight up the middle of the picture. So it's centered. This one is not so good because I'm off and you can see I've got distractions. I've got the person who's holding the mirror, their thumb is showing, and we've got the cheek showing over there. So when we start doing close-ups, center. Now remember the center doesn't have to be in the middle of the picture. So for this type of thing, if I put where I'm aiming in the middle of the picture, the driver will go off the top of the screen, but I want it level. Now with surgical photos, this will sound funny, you can't have too much blood because it just looks like a bloodbath. So you have to rinse the blood off, place gauze over the area to dry, get the camera focused, and then quickly whip the gauze out of the way so that the picture can be taken and there's not too much blood. If we go back to this picture here, this is the difference between flashes with, I think this is just a twin flash with no diffuser, and the other one with diffuser. So you can see one of the problems with hues, particularly paper diffusers, is you can change the colour temperature. Okay, now I want you to go and take these pictures if you don't do them. So you want to see this full face picture, f5.6, 1/100th of a second flash. This is just a ring flash. Okay, then now smile. Want to see the corners of the mouth. Make sure it's centre, make sure it's levelled. Try and avoid distractions. Aim on the lateral incisor for the lateral smile, just seeing the canine on the other side. You want to see both corners of the mouth. Retracted, try the big retractors. Sometimes the big retractors are too big for the patient, or you can't pull the cheek out far enough. So in this case, I would have to crop this picture to get rid of the distraction, which is all the lips. Teeth together, teeth apart. Now this one, I'm aiming at the lateral, got teeth together. I'm just pulling the retractor back as far as I can, and I can see the far canine. And then apart just a tiny bit. Upper occlusal shots, you really want the picture straight. You want to see the back teeth, have the patient open as far as they can, drop the mirror down till it hits the opposing teeth. Try and keep the dental assistant's thumbs out of the picture. Same on the lower, the lip's not really retracted far enough, so I tend to pull the lip away. And then your quadrant shot. Now notice how level it is. The canine is right on the left side, and the molar is right on the right side, and it just goes straight across like a straight line. This picture, you can see we're not looking straight onto the top of the teeth, we're looking a little bit from the sides. Now with shade photos, you want to take many pictures. So the top left is just standard, showing the shade. The next one is close up, showing the shade, not showing the shade. And then down on the far right, the bottom right, we can see the picture taken with the exposure down. So we've got the flash and we've turned it down one spot, so it's underexposed. And you'll notice how much more detail you can see with an underexposed photo. Obviously, if you want to see in, you can use the polarized or cross-polarized picture, which takes away all the surface glare, and then puts your shade guide up again. Okay. Sometimes it's good to have a black background and a tongue so that the technician can see all different options. The last picture that's really interesting is the lip at rest. So if you're doing big rehabs, often good to see this picture. This is how much tooth the patient's showing when they're not smiling. Okay, and then obviously the full smile. This is upper 6. This is really for demonstration of anterior aesthetic cases. You really want to show the final aesthetics. So I've put a black contraster, just a style Italiano rubberized black contraster behind the teeth. Now notice where I'm aiming. So notice that the centre of the picture is actually up on the gingiva. If you aim at the teeth, usually your picture will burn out because it's got too much of the black contraster, and so it tries to brighten the picture up. Okay, this is taken with twin flash with diffusers, so you can see the big flat white reflection on the front tooth. That's the diffuser clipping, shining in against the tooth. So this is the above view, and I think that's enough for one tutorial. So thank you very much for watching.